Now, as Nichelle Turner mentioned, Williams recently returned to rehab in an effort to maintain his sobriety. A spokesman for the actor says he had been battling severe depression. We want to talk about some of the struggles he may have been facing. We've brought in a clinical psychologist, Paula Bloom. Thank you so much for coming into the CNN Center to talk about this. And we should note, you didn't treat Robin. We don't know specifically, outside of the suicide, what caused it. But what does it tell us about his mental state, that he was suffering with severe depression and that he had made these attempts to get through rehab most recently in July?
Right. The thing about, and it was in the statement, it's not based on a diagnosis,
Sure.
They said that he was struggling with severe depression. The thing with depression, that is the leading cause of suicide, is depression.
Is it?
Okay? And what happens is that and depression is a biochemical brain disease. This is not some choice that he made. This is a disease. And one of the symptoms of that disease is that it narrows your field of vision. It makes it much more difficult to solve problems. So what happens is you narrow your field of vision, and what ends up happening is that the only solution to stop your pain looks like suicide.
But what makes this so shocking for all of us as we go through all of his famous roles, everyone here telling a story of something funny he did that really touched them, is we see often famous, successful actors and comedians dying in such tragic ways because of drug overdoses, possibly to cover up things. What about the life of a comedian? I mean, a lot of them say that they actually pull their material from some deep, dark experiences, but they're in these comedy nightclubs. Robin Williams really shot to fame in the 70s when he was a struggling comedian before he got that Mork and Mindy role. Is it wise to be getting free alcohol, jumping up on stage, venting so openly and being so vulnerable and seeing what a bunch of strangers think of you?
Well, a lot of times people who are actors and comedians, and you talk to them, they say they can't imagine doing anything else. They're called to do this work. And so you're right. It isn't the ideal situation to be in if you're vulnerable to mental illness or addiction. But a lot of times what it is this kind of mask that people can wear. They can have this double life. You know, people have been saying to me, I was on Facebook and talking about, oh my gosh, he was so funny, I don't understand. How well do we really know people? It's, you know, actors, they aren't their characters. And a lot of times comedians are almost acting all the time.
So it's almost perfectly suited for that type of character who has a professional mask.
Right, you can wear a mask,
So we do know he was suffering with severe depression based on the statement. For anyone watching now who feels that they may be suffering, what would you advise? I mean, I notice in the US, you get these commercials, you're bombarded with them that say, are you upset at this very moment? Do you have a lack of sleep? And I think to myself, oh my goodness, that's me. But is that the right thing to do, to simply prescribe a pill? What's the right approach for someone watching who feels they may be suffering with depression?
Sure. When it comes to depression has a lot of different characteristics to it. I mean, lots of disorders have to do with sleep. Being a new mother, that's a sleep deprivation. There's a lot of things that have to do with sleep. The big thing to look at with depression is, how are you functioning? When you're having thoughts of wanting to die, that is a serious warning sign. The good news with all of this is that depression is highly treatable. The problem is that the depression, when it gets bad, it tells you you're not depressed. It tells you life is terrible, life is hopeless. But I want people to know that they can get help, that they can get help.
And is it the kind of thing where you just talk to your doctor, seek out a psychologist?
You can talk to your doctor, you can find mental health. Here in the States, there are national suicide hotlines where you can talk to people if you need help.
But the help is there.
The help is there, and just remember, this is highly treatable. But one of the symptoms of depression is hopelessness, so it's hard to see it sometimes.
Thank you so much for coming in. Midnight here on the East Coast. Really appreciate your insight, Dr. Paula Bloom. We hope to see you again. Now, still to come, we will have much more on the life and career of Robin Williams. We'll be crossing live to the Walk of Fame on Hollywood Boulevard for reaction there. It's just past 9 in the evening. How the people he touched most are remembering the comedian's greatest moments. Stay with us here on CNN.